everyone, welcome back. So good to see you all. I hope everyone's been keeping safe and well. In today's video, I'm going to be talking you through all you need to know about incognito or lingual braces. These are hidden braces that go around the inside of your teeth, so they're super discreet. You don't see them when your mouth is closed. They're similar to traditional braces, the train track braces, in that they're made of brackets and a wire that runs through them, and they have tiny elastics to hold the wire in place, but they are pretty much invisible when you close your mouth. I'm going to be talking you through the process, how we get these fitted, the costs, and I'm also going to show you some clips of one of my patients that I treated in real life and his experience with Incognito. He'll be talking you through how he felt about having the process done, and I'm going to be showing you his before and afters. He very kindly allowed us to film the process. The first thing I want to explain to you is a little bit about Incognito braces. The process for Incognito braces, first of all, you need to attend for a consultation with your orthodontist. So you need to go have a checkup, let them know what your problems are. Now, not every case is suitable for Incognito braces. Some cases don't work as well, and you would be better off having the traditional braces around the outside or even Invisalign braces. So it really is a good idea to go to an orthodontist, discuss all your options. They'll go through the pros and cons of the braces and let you know which one is best for you. If you are suitable for Incognito braces, the next stage is to call you back in and we do some photos of your teeth, a mold or some scans of your teeth, which we often do now, and some x-rays, and we'll send these off to the Incognito lab. The Incognito lab will then manufacture your brace. Now, the braces are custom made, so they do take a few weeks to come back, and they're made of a gold alloy. They're really friendly with your oral tissue, and they're also soft when you bite down. It does also mean that the cost of these braces is a little bit more than your typical train track braces. Did you know an interesting fact is that Kate Middleton had these braces shortly before she got married? She had them done by an orthodontist, quite a famous orthodontist in London who is no longer practicing, Didier Filion, and she wanted her teeth to look very natural, and he incorporated little bends in the wires to make them look as natural as possible. So she doesn't have a perfect smile. She has slight rotations in some of her teeth, which is what she actually wanted. Now, in terms of the type of Incognito braces that are available, there are a few different kinds. So you can have the full version, and the full version is essentially a brace that goes around all your teeth, so it covers your molars to molars. Or the light version, which basically just straightens your front 6 teeth. So there are 2 different versions for Incognito, one that covers all your teeth and one that just works on straightening your front 6 teeth. So we call them your social 6. And again, which one you go for will really depend on your case. So if you have a few minor rotations at the front, which is your main concern, then it may be that the light version of Incognito is the right one for you. A little bit about the costs of Incognito braces for those of you who are curious. Now, the costs for Incognito really vary depending on whether you're going for top arch, bottom arch, both together, and if you're going for the full version or the light version, just straightening the front 6 teeth. So the cost does vary from about $2,500, I would say, to about $8,000. So it really does vary. And the reason that the cost is so high when you go for the full version is because the manufacturing costs for Incognito are very expensive. As I mentioned, they are made of a gold alloy, so the material is quite expensive, and the brackets are custom made to suit your teeth perfectly. In addition to this, to be a provider of Incognito, you do have to be specially trained, and it is a lot more fiddly than traditional braces to adjust and to fit, and just about everything about them is a little bit more fiddly. But they do work really well. I've had so many patients that are so happy with these braces because they're discreet and they just look wonderful. So let's take a look at my patient that had Incognito braces, and we can see just how happy he was with the brace. So how's the journey been for you?
It's been very good, yeah. Very good.
Yeah.
Everything's gone very well.
Fantastic, good.
Yeah.
And you went for the braces around the inside of the teeth?
The inside, yeah.
Yeah,
Exactly.
and how did you cope with that?
Yeah, they're pretty easy. It just took about a week to get used to the top and bottom, and then after that it was fine.
Brilliant. Okay, so we have Incognito braces here, which is a brace around the inside of your teeth. And I'm just going to show you what these look like because they aren't so common. That is, the brace around the inside of the teeth. So it's quite a cool brace, you really don't see it at all. Okay, so you've just had your brace off.
Yeah.
Teeth are looking amazing.
Very happy to have them off. And,
Good.
Feels very weird. My gums just feel sort of, I don't know, like squidgy, like a bit spongy, just on the top and the bottom.
Yeah.
My mouth just feels much lighter. Even smiling just feels different. So
They look amazing.
before, yeah.
And how's the process been?
Yeah, it's been really easy. It's been really, really easy, and you guys have been wonderful.
Fantastic.
Yeah, it's just been a really great service.
Okay. Okay, so here we have
They've changed a lot.
the before, yep. So you can see the top teeth were behind the bottom ones, and what that was actually doing was it was causing your gums to recede a little bit. It's just as well that you've corrected this, because that could get worse with time. So the treatment has not only, for you, it's not only been aesthetic, but it's also been functional as well. So you can just, yeah.
And I think they were rubbing, weren't they?
Yeah,
Together.
and they're rubbing and you're biting.
Yeah.
Biting on them in incorrect kind of position. That's from the top. Now the lower teeth. And that's them now, looking lovely. See the bites much better.
Yeah.
They fit together. They really fit together perfectly, actually. They look really nice. Now your gums are still a little bit puffy, but that will go down.
Yeah.
And that's your fixed retainer on there.
It just helps the gums tighten more and everything off.
You had the Incognito brace, which
Yeah.
is the brace around the inside of your teeth.
Yeah.
How did you get on with that?
Yeah, so for the first 2 weeks or so it was difficult just talking and getting used to it, and then after that there was no problem really. And no one could see them at all. In the whole year and a bit they were on, no one really knew they were
No one
there.
noticed?
No one
Oh,
noticed
my
at all,
gosh.
yeah. I know,
Wow.
it's amazing, yeah.
That's amazing.
Yeah.
And was your speech affected? Or?
Yeah, speech was affected for the first week or so, when I had the top one, and then again when I had the bottom one, but it was just S's and things like that. But then after that, you just got used to it again, and the mouth adapts to it, and
And did you have to modify what you were eating at all? Or?
For the first week or so I did just sort of soup and porridge for breakfast, but then after that it was, fine,
Fantastic. Thank
Very
you
happy.
so much. Good, thank you.
So thank you very much for watching, everyone. I hope you've enjoyed this video and found it useful, and you've learned a little bit about Incognito secret braces. If you have any questions, please do drop me a comment in the comment section below, and I promise I do try and answer as many questions as I can. Perhaps you've had Incognito braces, perhaps you have Incognito braces, or you're thinking about having them. If you do, let me know. I'd be interested to know how you're getting on with them. If you've liked this video, please do give it a thumbs up. If you haven't liked this video, please do give it a thumbs up too. If you haven't already subscribed, then why not hit that subscribe button? Make sure you hit the bell notification button as well to make sure you receive updates to all of our wonderful and useful videos. Until next time, take care and keep smiling.